Now, we as humans have got this amazing facility for this frontal cortex. Now, look at the animals. The frontal cortex is really small and the limbic is big and the survival cortex is big. So, if we as humans have to explore our entire potential, if we were to bring in all the best things that you and me can do, then we need to focus on building, really strongly building this frontal cortex, without which nothing can happen. Now, the same thing for our patients. If the patient is stressed, if there is burnout, if there is too much of trauma happening in the person's life, and trauma can be micro emotional traumas, which is just enough, people come and talk to us about all the relational issues. There's lots of, I was just looking into the divorce rates, and there is a big, huge divorce inventory which is published of late. There's 74% divorce rate in one of the countries, I think it was Russia. That's just alarming. That's just incredible, right? So the question comes is, there is so much of a disconcordance happening when it comes to relationship. So when the person is stressed, this prefrontal cortex is out. There's weaker control of emotions, and then you don't know what you're acting out, because you may be acting out completely in a state of emotional disarray, and that may not be the right state. Now, there are four fundamental brain waves. So you understood the three parts, and then there are four fundamental brain waves. The first is, as I'm talking to you, we are integrating in a chat. It is the beta, because I'm concentrating, I'm thinking. That is my fast rhythm called beta, which is generated. The moment I close my eyes, there is a slow rhythm called alpha, which is generated. When I'm about to go to sleep, just before I sleep, there is theta, or a little bit of a dreaming stage or a trance state. And when I fall off to sleep, the slowest wave called delta comes in. Now, all these waves have roles to play. How do we decide which part of the brain is well functioning? We should go and check the waves, the way the waves are functioning. Is there enough modulation? Am I able to move into theta and alpha? How good is my alpha peak? How symmetrically distributed are my waves? How is the coherence? How is the crosstalk happening between the two sides of the brain? How is the crosstalk between my emotional center and my prefrontal cortex? All this is very simple and easy to determine. So let me show you from the lab one of the brain scans that we have. So if you focus on your left, there is high beta. You see some green and orange, kind of orange-red color on the first half. Now, after one single session of Brahmari, we took a repeat this after just one single Brahmari. For all those who is not aware, it's also called the humming bee technique. Is what you do from the palate as long as you can. Some people close the tragus. There are various versions, but in the Western sense of it, it's called humming bee, and in the Eastern sense of it, it's called Brahmari. It's one of the pranayams. I love the word pranayam itself. It's the vital force of prana, and you're trying to, get back that vital force. So in that, if you see just after one single session in that high beta, there is this change of the color. There is red means higher, more amplitude, increase in the size of it or increase amplitude of it. So just by one single session, you were able to shift that amplitude. Now, if I keep on doing this over and over and over and over again, I can quickly get into that states, even sometimes without the Brahmari. And when you have high beta, multiple repeated high beta episodes, you develop gamma. And gamma is one very important rhythm, which is for overall cognition, overall understanding and development. The learning becomes very fast. The emotional regulation is super good. The depression goes away, anxiety goes away. So all those are seen in people who meditate. Now, same thing for a colleague of mine. You can see it in the meditation space. There is little theta on your left, at the center right here, the last small red, just 5 minutes, simple 5 minutes of a meditation. By the way, there are many varieties of meditation, and some of you can join one of our online sessions where we talk of neurotyping of the meditation. Some of them would need concentration, some of them would need visualization, some of them would need relaxation, some of them would need forgiveness and love. So it's not just that any meditation is fine. Now, if you typify it, if you individualize it, the effect is slightly better. That's all. I mean, any meditation, for as long as you do it repeatedly, as long as you make sure that it's consistent practice, it's good. So you're seeing this shift in the second half where you see a lot of theta. There is a red, literally like a red pool of that color, which is the excess of theta, which is now generated. The next time when this person further meditates, possibly in the baseline state, this is a dynamic scan because we are asking the person to do something. in the baseline also you can have a high theta. That is very good because now the person can access all the creative features. It's like a little trance state. You go beyond the typical understanding, etc. There are enough studies. This is one of the study from Harvard where they have done a functional MRI. Functional MRI is always quick, easy, but very expensive. So very difficult for us in the private settings to do it on a regular basis. But this is a study where the red signal that you see on the right-hand side is the signal of the amygdala, is the signal of that limbic part which is active. And after months of meditation, you see that limbic part slowly subsiding, the color fainting and making it towards yellow. Now, these are followed up experiments, and lots of such experiments have suggested what are the changes which are happening in the brain. There's one example which I can quote here of a professor or a teacher of mine. He's a yoga master. He's also a physicist, a scientist who has been doing these practices for every single day, right from the getting up early in the morning at 4 o'clock, about 3 or 4 hours of practices. And you do see an entire red gamma, which means there is very high gamma happening, very high beta, very high alpha, very high theta, and obviously which indicates that your entire brain is now functioning. There is availability of those connections, etc. Now, this is a live example. And frankly, I always tell my patients that, look, I'm going to prescribe to you something which has benefited me. The things that has benefited me has been breathing, has been meditation, and some form of chanting. Now, breathing, many varieties and types are available of pranayam. Each and every pranayam has a significant role. Anulom Vilom, the alternate nasal breathing, has a separate role in the brain. Your Bhastrika has a separate role. Bhramri has a separate role. Each of them have scientifically been studied, and enough evidence is there for showing what is happening in the brain. Now, why it should be there, because we need to go to the why of it before we just say, hey, it's just a pranayam. It's not just a pranayam. It is a pranayam which can make your life better, which can make your life changed. It can change the structure and the chemistry of your brain.